Sue, thanks for coming in today. It's a pleasure to have you here. We're going to talk today about your diagnosis, your cancer diagnosis, and in particular your breast cancer diagnosis, which was 2012.
Yes.
First of all, how did that come about? How was the diagnosis picked up?
I found a lump, and for 2 months I just monitored it thinking, is there really a lump, isn't there a lump? Some days I thought there was, other days I thought maybe not. But in the end, I just had to know for sure. I made an appointment with the doctors. Now, unfortunately, that took 3 appointments before anything got done about it, because they didn't have nurses available and all this, that and the other. But when somebody actually took notice, it was shock horror. Yes, you have got a lump. Within 2 weeks, I was in hospital having surgery. That was my first big hurdle because I didn't want to be disfigured by surgery and scarring. But I got over that. It was a bit unpleasant. Me not wanting to sit down and not do anything. I had my surgery on the Thursday and decided to cut the grass on the Saturday. But my body said that wasn't a good idea. So I spent a week then not being very well at all. But then I paced myself a bit better from there on. Then I started with the chemotherapy. That wasn't as bad as I'd feared it to be. Because chemotherapy, everybody goes, oh, shock horror, you know, it's just one of those buzzwords. But for me, they said, because I'd started out so fit and healthy anyway, it took longer for the chemo to actually get me down. So it wasn't until my last 2 cycles that I actually started being sick when I was given the chemo and after I'd had the chemo. So I deem I was quite lucky with that.